फिश खानी शुरू करता हूँ.
Always walk through life as if you have something new to learn, and you will. Jai Hind and very warm good morning to one and all. Under the dynamic leadership of Dr. Nikhil Srivastava, Sir, Dean and Principal, Subharti Dental College and Hospital, in continuation of Subharti Alumni Lecture Series, it's my honor and privilege to welcome you all. I, Dr. Napreet Kaur, Associate Professor, Department of Pediatric and Preventive Dentistry, is delighted to introduce you all for this today's enlightening session, Beyond BDS Pathways, Prospects and Possibilities, that is going to be taken up by one of our esteemed alumni, Dr. Natasha Gambhir, ma'am. So before moving forward, I would like to request Dr. Vivek Rana, sir, in charge Department of Pediatric and Preventive Dentistry, to formally welcome our guest speaker today. Thank you.
Jai Hind everyone. A warm welcome to Dr. Natasha. Dr. Natasha, kindly accept the floral welcome as a token of respect and appreciation from the Department of Pediatric and Preventive Dentistry. Now, I would like to invite Dr. Tushar to formally welcome our guest speaker, Dr. Natasha Gambhir.
Jai Hind, very good morning to one and all. It is my pleasure to introduce Dr. Natasha Gambhir ma'am. Dr. Natasha Gambhir ma'am did her BDS and MDS from Subharti Dental College and Hospital, Meerut. She is currently serving as a professor and head of the department uh, and assistant dean at Santosh Dental College and Hospital, Ghaziabad, with a teaching experience of more than 16 years. She has authored several international monographs and has a numerous publication to her credits. She currently has around 70 plus articles published in index journals and 15 books and 11 patents. She is currently serving as a member of various national and international pediatric dentistry societies. She is also a part of various committees at the university level, such as NAC, Cultures, and NABH. She has been invited as a guest speaker and chairperson in numerous conferences and also has an external examiner by various universities. She has numerous awards at national and international level. Now, I would like to invite Dr. Natasha Gambhir ma'am for the lecture. Thank you.
Hello everyone. Let's start this lecture on a positive thought. The future belongs to those who believe in the beauty of their dreams. I'm Dr. Natasha Gambhir, currently serving as Professor and Head of Department, Pediatric and Preventive Dentistry, and also as Assistant Dean of Santosh Dental College and Hospital, Ghaziabad. I'm a very proud alumni of Subharti Dental College. I did both my BDS as well as my MDS from this institution. I would take this opportunity to express my gratitude to Dr. Atul Krishna sir, the visionary leader, late Dr. Mukti Bhatnagar ma'am, Dr. Shailya Raj, and our ever dynamic Dr. Nikhil Srivastava sir for giving me this opportunity. I would also like to thank Dr. Vivek Rana sir, who's an esteemed academician and also my guide and mentor. I would also like to thank Dr. Nupur as well as Dr. Tushar, who are my friends as well as very nice colleagues, for giving me this platform. This is my department at Santosh Dental College where I practice. It's a very nice, vibrant department. And today I'm here to talk to you about the pathways, prospects, and possibilities after BDS. I strongly believe in the fact that opportunities don't happen, you create them. Bachelor's of Dental Surgery, as we all know, is a 5-year course in which the first, second, third, and final year we study, and at the last year we get our internship in which we get to practice whatever we have learned in the 4-year duration. Well, so when you take admission in your dental course, you think that what we're going to do is just practice. But let me tell you, after this lecture, you will be able to understand how broad our horizon is. So just to enumerate, dentistry allows opportunities in entrepreneurship, research, teaching, academic opportunities, public health and community dentistry, government job opportunities, short service commission officers in defense service, civil service examination, hospital administration, corporate and industry opportunities, and opportunities abroad. Also, there is a greatly increased demand for newer services such as pediatric dental care, geriatric dental care, implants, cosmetic dentistry, and they all contribute to the growth of this profession. So to start with, the main thing that we look forward to after finishing our BDS is our MDS, which is our Masters in Dental Surgery. So let me tell you that we can do our Masters in Dental Surgery in 9 branches of dentistry: oral and maxillofacial surgery, periodontology, prosthodontics, oral medicine and radiology, oral pathology, orthodontics, pediatric dentistry, public health dentistry, and conservative dentistry and endodontics. I'm a pediatric dentist, so I'm just going to show you what all you can do in pediatric dentistry. When you come to the pediatric dentistry department and start your MDS, you'll have your set of preclinical work that you need to finish. There'll be, demonstrations, lectures for you. There'll be seminars, journal clubs for community, pediatric dentistry. We also do a lot of school dental health programs, and we also practice under conscious sedation and general anesthesia. So this is just a brief outline of what you can do in one department. So whatever branch you join, there'll be a lot of things compiled which you will be doing during your 3-year MDS course. Now, if we just decide to, not do our specialization, we can straight away go into our private practice. Now, you can have your private practice, you can have a group dental practice or a hospital-based practice. And if you've done your MDS, after that, you can also just do your specialty dental practice. Now, when we start our own practice, I say that you can work as an entrepreneur. Dentists, luckily, are their own bosses. A dental clinic is both a healthcare service and a small enterprise. And you can start your own practice, making your clinical skills as the foundation of your business. This is just a brief chart to tell you that how much would a clinical setup cost for a rented property to start a clinic initially, depending upon the area, the place, and the gentry that you're serving. It could be anywhere between 24 to 56 lakhs. Whereas if you have your own property, which you've already taken, minus the property cost, it should be between 20,000 to 20 lakhs to 43 lakhs investment. This is just to outline the kind of income that you can, generate typically, depending upon again, all this is dependent upon the hours of work that you are putting in. So if I decide not to start with my practice, what is it that I can think of? The other things, we could go into research. A dentist can pursue research to advance dental sciences and clinical practice. Clinical experience helps dentists identify real-world problems for research, and also research bridges the gap between laboratory findings and patient care. And these days, it is the era of research, and a lot of job opportunities are available as research, starting from ICMR to abroad. You can do research in various fields like dental materials research, which focuses on developing and improving materials used in dental practice. Clinical trials and evidence-based dentistry you can do. Scientifically evaluate the safety and effectiveness of dental treatments. You can get research about product development and patents. Dentists identify clinical problems and develop practical solutions for them. You can collaborate with medical and engineering fields, and work alongside medicine and engineering for advanced care. Besides research, you can also look for academic opportunities right after BDS as a tutor. The dentist can enter academics by teaching undergraduate dental students. Academic roles involve lecturing, clinical demonstrations, and student mentoring. So if you join straight away after your BDS, you work as a tutor, and if you join after your MDS, then you work as a senior lecturer. Your academic and teaching career would incorporate you being a part of the dental college faculty. You will have both teaching as well as clinical practice. You will get a first-hand exposure to research and publications, and you will also be guiding undergraduate as well as postgraduate students. Another thing you can do is join public health and community dentistry. You can, there are a lot of government health services in which focus on oral health prevention and basic dental care, and you can apply for such jobs. There are national oral health programs which aim to improve oral health at the population level, and dentists play a key role in prevention, early diagnosis, and community awareness. Also, you can work with NGOs and community outreach to deliver oral health care to underserved communities. And we can also get into epidemiological research. In this particular field, it provides data for planning preventive and public health programs, and it guides policy making and allocation of healthcare services. Besides this, we can also look for government job opportunities. You can secure a government job through central and state health services, and opportunities exist in hospitals, dental colleges, and public health institutions supported by the government. Another good option is the short service commissioned officer of being a short service commission officer in the defense services. Dentists can join the armed forces and serve as a dental officer in the Army, Navy, or Air Force, and provide comprehensive dental care to defense personnel and their family. This combines clinical practice with discipline, leadership, and national service. Well, if you want to aspire to get into the civil services, you can also do it after you finished your BDS. You can appear in the UPSC civil services to join administrative roles. Opportunities include the IAS, IHS, and related government positions. This allows dentists to influence public health policies and healthcare administration. And this particular service will combine leadership, governance, and healthcare expertise. Well, we can also choose to go into hospital administration, and choose to manage dental departments or an entire hospital in their administrative roles. This will involve planning, organizing, and supervising hospital operations, and focus on patient care, quality, resource management, and team coordination. So after your BDS, you can pursue a hospital administration course and get into doing this. We can also look for corporate and industry jobs. You can look for jobs in a dental product companies. In this, dentists can work with dental product companies in clinical and non-clinical roles, and this clinical knowledge helps, and their clinical knowledge will help in development of the product, its testing and validation. Roles include but are not limited to clinical advisors, product specialists, medical affairs, research and development support. Also, you can get involved into medical marketing and sales. The dentist can work in medical and dental marketing roles using their clinical knowledge. This involves promoting dental products, equipments, and technologies ethically. Can also work as a clinical advisor or a trainer and train for dental companies and institutions. The role involves training dentists and students on new material, equipment, and techniques. You can also work as a quality control and product testing officer. In this, the dentist ensures that the dental products meet safety, quality, and performance standards. It involves testing dental materials, instruments, equipments before market release, and evaluates biocompatibility, durability, and clinical effectiveness of materials. Now, besides this, there are also various opportunities available abroad. If you decide that you want to pursue your career further, in the abroad, then you can go in for higher education, that is MSc, MDS, and PhD in other countries like USA, UK, Australia, and Canada. Your clinical practice abroad often requires a licensing exam. It could be NBDO or BDC. Opportunities exist in private practice, research, teaching, and public health. So you can choose what is it that you want to do, and then you can accordingly figure out a plan to study further. So this is just a brief summary of what all exams or study process would be required for your entry into various countries. Like for Canada, you'll have to NDEB equivalency process should be there. There's going to be an assessment of your fundamental knowledge, assessment of your clinical judgment, and then assessment of your clinical skills. And you can also do an advanced standing program in Canada. For Australia, you'll have to clear the Australian Dental Council exam. UK, again, you have to give the overseas registration examination and get a license in dental surgery. For USA, again, you have to give the INBDE exam, followed by advanced standing DDS, DMD programs, and give a state licensure exam after completion of your graduation. If you wish to go to the UAE, then there's a DHA exam. Also, there is a Ministry of Health exam. Depending upon where you want to practice. For Abu Dhabi, there's a DOH exam. So all these exams need to be given, in which they obviously test your theoretical as well as your practical and clinical knowledge. So besides this, there are a lot of other things that are happening in dentistry, like a lot of transformation is happening, and dentistry is progressing towards digital dentistry. So we can do some short courses and expand our practice. Maybe in the maybe if you want to extend, if you want to do something in the field of diagnosis and treatment planning, you can learn how you can go in for CAD CAM, 3D printing. Or you can think of minimally invasive and preventive procedures and gain your focus on them. You can also opt for laser dentistry, robotics. Also, as we all know, artificial intelligence is the upcoming thing. So we can, do some short-term courses in this and pick one field and grow ourselves in that. Well, the skills required to succeed are manual dexterity. Of course, you have to be very good with the work that you do. You have to constantly work on your communication skills so that you can deal with your fellow colleagues, your bosses, and also your patients. Also, it would be advisable to develop a lot of scientific thinking so that you can, think of whatever research or research or capacity building that you can do. We need to be empathetic and do an ethical practice. And we should always remember that we have to follow the continuous learning attitude. So I would just like to say that dentistry offers many opportunities, challenges, and rewards. It is rapidly changing and expanding profession. Dentists can easily balance their personal and work life to meet their individual needs and desires. Dentistry allows you opportunities in private practice, research, teaching, public health, and as well as administration. In the modern era of healthcare, dentists utilize new and advanced technologies such as computer, digital imaging, cone beam tomography, and magnetic resonance imaging in diagnosis of patients. Dentists provide services that improve patients' appearance and self-confidence through a wide variety of cosmetic dental procedures. Dentists are often the first healthcare professionals to recognize and identify a wide variety of diseases ranging from hypertension to oral cancer. So, the work of the dentist extends beyond the dental chair to educate the general public on the basis of oral health and disease, thus interacting with people of all ages, culturals, and personals. Also, there is a greatly increased demand for newer services such as pediatric and geriatric dental care, implants, and cosmetic dentistry, which is also contributing to the growth of the profession. So after you finish your 1 year of internship, you have to get yourself registered with the dental council, and which is very important for you to begin practice, open a clinic, or pursue your MDS. I'm sure you must have been left thinking about what to do now. So the thing that you have to follow is first think which branch of dentistry excites you the most. Where is it that you want to build your practice? You have to ask yourself whether you want to get into clinical practice or research, whether it's going to be India or abroad, and how do you see yourself as a dentist. So after you've thought over all these things, then you can make a correct choice of which particular path you want to pursue after you've taken your finished your bachelor's in dental surgery course. I'd like to show you a video. So there'll always be people and comments who make us doubt ourselves, but we have to just, be thinking that, we are good enough to do whatever we wish to do. In the end, I would like to conclude by saying that your BDS is the beginning and not your destination. You can just open your horizons and think further and see what you want to do next. All the best. Thank you so much.
Thank you so much, ma'am, for such an informative lecture. I'm sure everyone must have gained meaningful insights and clarity on the topic beyond BDS, prospects, pathways, and possibilities. So we have a question, ma'am. Shall I start?
Yes, please.
How important is it to pursue MDS?
So, as we all know, this is the era of specialization. Even if we want to go for a stomach ailment, we'll go to a gastroenterologist. So, everybody seeks to go see a specialist. It is important that we specialize in a whatever field we like, whatever branch of dentistry we like. But yes, it is important these days.
Thank you so much, ma'am, for your wonderful answer. Now, I would like to invite Dr. Nikhil Srivastav, sir, to present Certificate of Appreciation to Natasha Gambhir, ma'am.
Hi Natasha, good
Hello,
morning.
sir.
Jai
Jai
Hind.
Hind. Good morning, sir. Good morning, sir.
Yeah.
मैं ठीक हूँ, sir. It is always a pleasure to be invited by Subharti. Thank you
Thank you
so
very
much,
much.
sir.
No, actually, we wanted to invite you physically, but because of your constraint and our constraint, now we
Yes,
thought,
sir.
okay, let us start
Yes.
online, and then you can always
Yes.
come physically, right? So
Absolutely, sir.
I
Absolutely.
just
Thank you
went
so much,
through.
sir.
I was just listening to your lecture. It was wonderful. You
Thank you
gave a
so
very
much.
clear guidance to the students what they can do. In addition to your lecture, I just would like to add two things. There is one very wonderful opportunity for BDS graduates who, because of any reason, couldn't get selected for post graduation. I mean, for sure, the first choice should be to pursue post graduation, right?
Hanji,
Specialty
Hanji.
is not your choice. But supposing because of financial constraint, because of your ranking, because of anything else, if you can don't get selected, I think the best option to go for MSc in basic medical science subjects, right?
Yes, sir. Yes,
Like,
sir. Yes, sir.
the government has opened medical colleges in every nook and corner of the country. We have so many dental colleges, nursing, physiotherapy, natural, everywhere. No, you will find you need basic science teachers, and they are in scarcity. There are hardly, you will not find many teachers for anatomy, physiology, biochemistry. So, doing MSc in basic sciences like anatomy, physiology, biochemistry, microbiology, you can be employed as a faculty member in any of the medical,
Yes.
dental, physiotherapy, nursing colleges.
And there is a scarcity of
Too
such
much.
doctors also. Yes, yes,
Yes,
sir.
yes.
Yes,
Basic
yes,
sciences teachers are not available.
yes.
So you can add in your presentation for future.
I
Now
will,
you can
sir.
always do that.
Yes, sir.
Even
Yes, sir.
Subharti offers MSc in various medical subjects, right? So supposing you go through that, you become the teacher. The only rider is that you will not be promoted beyond associate professor if you are only MSc. Hello, disconnect to me. So what you can do after doing MSc, you can enroll for PhD and then you can be promoted to the post of professor. So this is one very important thing. Second thing I just like to tell you, that, which is a recent notification from UGC. Uh, till now, for pursuing PhD, you needed a post graduation. Okay, before post graduation, you were not supposed to. You are not eligible. But now, in the recent notification, the UGC is thinking that even after doing your graduation, you can enroll for PhD. The notification is yet to come, but then this is the very concrete, very confidential information. So all those who are listening now, they can always opt for these two courses. And those who are planning to go abroad and settle down, PhD is one of the mandatory requirements. There outside India, MSc is not, MDS is not the highest qualification. They need PhD. If you want to become the professor, if you want to become the head of the department, head of the institution, you need to have the PhD. So the PhD is the in now. So wherever you get, you should enroll for this. So these are two additions I just wanted to tell you. Right now.
Absolutely, sir. Thank you so much. Thank you so much for adding, sir. Thank
Thank
you.
you so much. And on behalf of department and the college, kindly accept the certificate of appreciation for your time and your lecture. Thank you so much.
Thank you so much, sir. Thank you so much for inviting me, sir, and giving me the
Thank you.
opportunity. Have a
Bye.
nice
Bye.
day, sir. Bye, sir.
Thank you.
Bye.
Bye.
Respected, respected faculty members, alumni, and dear students, on behalf of Subharti Dental College and Hospital, I sincerely thank everyone for making this event successful. We are deeply grateful to our alumni speaker, Dr. Natasha Gambhir, ma'am, for her inspiring and insightful lecture. We express our profound gratitude to Dr. Atul Krishna, founder of Bharati Group of Institution, Professor Dr. Pramod Kumar Sharma, Vice Chancellor Swami Vivekananda Subharti University, for their constant support and visionary leadership. We also thank Dr. Shailya Raj Ma'am, CEO, Swami Vivekananda Subharti University, and EO Dr. Krishna Murthy Sir, Dr. Nikhil Srivastav Sir, Principal and Dean Subharti College and Hospital, Dr. Vivek Rana Sir, in charge Pediatric and Preventive Dentistry, for their guidance, encouragement, and gracious presence, which added immense value to this event. I would also like to acknowledge the efforts of the organizing committee, faculty members, Dr. Nupu Kaushik ma'am, Dr. Tushar Paruthi sir, Dr. Paru, and the postgraduate students of the Department of Pediatric and Preventive Dentistry, whose dedication and teamwork ensured the smooth execution of this program. Finally, I thank all the participants and students for their enthusiastic involvement and active interaction, which made this lecture series truly meaningful and successful. Once again, thank you all for being a part of this enriching academic event. Thank you and have a wonderful day. Jai Hind.